Hello, everyone. Welcome to the ERAS CV application guide by Walking Thoughts. My name is Dr. Arfa Masiuddin, and I will be conducting this session. Every advice and suggestion and guidance that comes through this session is based on my years of experience as an ERAS consultant and the discussions and that we have with program directors and chief residents. So, without wasting further time, let's get down to it. I will be giving you a complete rundown. If you have any questions or any queries or anything that you want answered, either you can put it in the comment section, or I will just share my official WhatsApp number and social media links towards the end, so you can also reach out to us there. So in order for you to first understand why your CV or application needs to be the way it is, you need to understand what the purpose is. The purpose of the CV is to present a clear, concise, and compelling record of your medical education, clinical experience, research, volunteer work, and any skills necessary for a medical residency application in the United States. Now, remember that your personal statement is more about who you are as a person. That's your personality, your life experiences, and who you have grown into, whereas your CV is strictly professional, a sum of your academic and professional achievements or anything you've done. Now, the ERA CV is it's a format that you get, a template that you get, and you have to kind of like fill in the blank type of thing in there with limited word count. So because of the limited word count, you have to be very mindful of what you're writing. So why is this CV important? Because just like you're applying for any job, it will help the programs assess your competencies. However, in case of ERAS, they will assess your qualifications based on the ACGME core competencies, because that is the benchmark that they have. Now, all of the ACGME core competencies need to be reflected across your application, and your application consists of your personal statement and your CV, or this particular application. There's one CV, and then there's the application where you're putting in your geographical preference, meaningful and impactful sentences, experiences, and all of that. So together with the personal statement, that makes your entire application. So your CV needs to highlight your clinical readiness, which means how much clinical experience you have had, your adaptability to the US healthcare system, which might be shown through US clinical experiences, and any relevant achievements. What differentiates you from other applicants? Through meaningful, well-articulated experiences with assigned core values. Initially, it used to be just the experiences section, but how do they find out more about you? That's why they've introduced the primary focus and key characteristics and meaningful experience and impactful experience session. So you have to keep, again, there's the word count. So you anyways have to keep it concise and focused. Now, there is some debate about whether your CV has to be in bullet points or prose. A lot of people sometimes, I wouldn't say a lot, in fact, a few people sometimes opt for the prose format, but we don't encourage that, and program directors don't encourage that, because, see, it makes sense that they have thousands of applications, hundreds of applications to review. They're already reading a prose format in the when they're reading your personal statements. If the CV also becomes that, what will be the difference? CVs all over the world, the standard format is bullet points. So you keep it short, you keep it concise, but you keep it impactful. How? We'll just come to that. So in your experiences, you have to highlight all the relevant clinical rotations and clerkships and any hand-on patient experience you've had. Obviously, the name, institute, date, and sponsor, all of that is going to be mentioned over, is the fill in the blank which you have to fill in. Now, a lot of the candidates often end up writing the name of the doctor or the attending they have rotated with under that particular observership section. I and a lot of other people vote against that. We advise against that. The reason is that this is to avoid any bias. You don't know which program director is on good terms with which attending and whom they're not on good terms with. So if you're going out of your way to mention that, you are doing it because you think it might put a good impression, but that's unnecessary, because you're already putting in the name of the institute, right? So you don't have to put in the name of the program of the attending over there. The LORs that you're getting from, yes, of course, they're from, they are already going in, right? So that is another thing. But doing the extra thing is writing it down in your CV as well. So don't do that. If the program director is not on good terms with attending you worked with, it might create a bias. So why would you want to get there, right? So don't take the risk. There is the writing the name of the attending is not doing you any good. Writing the name of the institute or the organization is, and which is why it's supposed to be there. So yes, research publications that you already know. And that's something very straightforward because, again, like I said, it's a template that you get, you have to just put it in. Coming to the meaningful and impactful section. Now, the meaningful section, the meaningful experience section has to be fluently phrased such that it reflects the mentioned key characteristic and is no more than 300 characters. So what does that mean? So in the 10 experiences that you have, out of those 10 experiences, the first 3 are going to be the ones which you will pick on as your meaningful experience. Now, whatever meaningful experience you write, you have to relate that to the key characteristic that you have chosen for that particular observership or work experience. How? I will just show you that in the next slide. That is a meaningful experience. And because it is amongst the 10 experiences, it is most likely to be professional, either a work experience, a volunteer experience, or a research experience. Now, the impactful experience section is something that you have not mentioned anywhere else in your application, for example, in your personal statement or anywhere. Now, why? It should make sense. Now, every time I'm giving you something, I'm trying to back it up by logic, so you will understand the reasoning behind it, the logic, the common sense behind it. They'll be reading your personal statement, they're reading these. Why will they want a repetition? Why will they want to waste your time and their time? That's not how it works. So in the impactful experience, they want to hear something. And again, this is optional. This isn't mandatory, it's optional. So in the impactful experience, they want to hear something about you that they have not read anywhere else, something different about you, something that really, see, it shows by name, right? Impactful, something that had an impact on you like none other, something that had an influence on you like nothing else. So this can be anything. This can be a personal experience, for example, losing a relative, losing a loved one, a divorce, a marriage, a birth of a child, financial struggles, anything. Okay. But you have to justify it as to why and how it, now the focus here has to be on how it made you grow as a person and the impact it had on your personality. Right. The reason it's optional again is because it's not necessary that everyone will be able to come up with one. But if they have given you the space and if they've given you the option of showing or flaunting your strength, grab that. So do not leave this impactful experience section empty, even if it's optional. Do try to fill it in because this application is your best shot at showing them all of your strengths and pitching yourself to them, right? So make the best use of it. So I hope it was clear the difference between meaningful and impactful and what you need to write. Now, in meaningful experience, here is an example of a strong meaningful experience. Okay. For example, the experience was an internship at Jinnah Postgraduate Medical Center. This is again just an example for you. How will you write the meaningful? Now, you can give a very generic example also, and you can give a very meaningful example also. Now I'll show you what a generic example is. The generic experience will be, this internship was meaningful because it helped me learn a lot about internal medicine. I improved my clinical knowledge and worked with patients from many backgrounds. I developed important skills like teamwork and time management. This experience made me more confident as a future doctor. If you're writing this is a weak example. This isn't standing out. This is not going to impress me. This is not going to impress the program director or the chief resident or anyone who's reviewing your application. Why? Because this can easily pass off as a meaningful experience of anyone else, of any other doctor for any workplace, not specific to JPMC, right? Not specific to that. Now, for this generic experience, the key characteristic it's connecting with is teamwork, leadership, communication, reliability, and dependability. So if we were to change it into something which is more personalized, this will be it. During a night shift in the emergency department, I treated a middle-aged woman with diabetic ketoacidosis. She had traveled hours for care, alone and frightened. I stayed by her side through the night, monitoring her vitals, helping her communicate with the team, and even offering emotional support. That night, I realized the importance of human presence in healing. It was not just about IV fluids or insulin, it was about compassion. Now, this is something that I can say, okay, maybe this is something that just happened over here. This sounds like something that happened only with this applicant. This is standing out to me. This is showing to me that, okay, this person has paid attention. They have invested time and effort into their CV also. So it's leaving a good impression. And which key characteristic is this being related to? Empathy and compassion tops the list. So you will put in the key characteristic empathy and compassion, and then you will write something of this sort. So I hope it's clear now that how you're going to phrase or how you're going to write your meaningful experiences. So the difference is that the generic version, which I mentioned earlier, was just naming the qualities but not demonstrating them, and that is what needs to come in. Do not forget to include leadership and extracurricular activities, but this doesn't mean this has to go down to back in school. Anything that is relevant within the past 5 years, that will be good. Why? Because they want to see well-rounded, interested individuals. Emphasize on your clinical skills, any certifications that you may have had. Now, the geographical preferences, some programs may favor applicants who have a preference, and especially if they believe you're likely to stay long term. So again, it depends on how you're phrasing it, but just be honest over here, and there is no harm in setting your geographical preferences. A lot of the times candidates are like, okay, we don't have any geographical preference, we're happy wherever we are. So that is something still debatable, because if people have a lot of some programs say, no, we do pay attention, and others are like, it doesn't matter to us. So proofread carefully. Spelling and grammatical errors create a very negative impression. So proofread it multiple times and ask somebody else to review it too. Stick to the American punctuation, American spellings, and American grammar. You can customize your CV for each program or even each specialty. Make sure you're doing that. Now, a lot of people will have same experiences for family medicine and internal medicine. What are you going to do for internal medicine? Make sure you're highlighting points in the experiences description which are relevant to internal medicine. And for family medicine, obviously, it's diversity of age and problems and building the connection with long-term connection. So you kind of emphasize more on that. So make sure you pay good attention to it. Now, when you're writing the bullet points, use strong action verbs. For example, starting off with managed, conducted, analyzed. Why? Because you need to make your CV more compelling and engaging and impactful. How? Let's just see it on this slide. Okay, some examples are led, implemented, coordinated, achieved. And then quantify your accomplishments. Wherever possible, include numbers, percentages, or specific data. For example, led a team of 5 medical students in a community health outreach program, providing primary care services to over 200 underserved patients. So this is starting off with an action word. This is quantifying, and this is impactful, showing what exactly you did. This is something that will impress them, rather than volunteered for a community health program, provided primary care service. No. Okay. So they should be brief, to the point, and effective and efficient. So tailor your CV to highlight different aspects of your experience depending on the specialty you're applying to. Again, this is something we talked about. Your letters of recommendation should also reflect the competencies required for each specialty. So this is just something I'm putting in, that this is how you can strategize your application for multiple specialties. So don't use overused ChatGPT words. The ones I've listed over here: solidified, unwavering, resonated, reinforced, profound, underscore. Just like in the personal statement, you should avoid these overused ChatGPT words, avoid them in the CV as well. So remember, all of this takes time, or this isn't something you can use ChatGPT to generate. This will take a lot of time, because that will give you very generic answers. That will give you very generic statements. But you are the one who truly understands which experience was, how did that work out for you, right? So a lot of time. When you sat down to write your CV, it will easily take 3-4 days of yours. Personal statement will take months, but CV is going to take 3-4 days for you to brainstorm and come up with unique points that you can include over there, and unique ways to highlight those points in. So please start now. By now, I mean April, May is the time where you should start working on your applications. Even though the token you'll get it in middle of June, but the template is available there. You can get it from your seniors and you can start working on it. Otherwise, as soon if you can't get access that template, then just wait till the token opens, till you can purchase the token and the portal opens, and just get right to it. But start now, do not leave everything for the end. If you have any more questions, if you need our help, or if you want to sign up for our services, you can do so by contacting us on the number that is mentioned, that will be appearing on your screens and will be also there in the caption. And you can also follow our social media handles. We've had a very good track record with applicants matching despite a lot of red flags, huge gaps, and however, we do have very strict timelines. So feel free to check out our social media pages for reviews of our former clients uh, who have availed our services, and the process has been made very efficient and less time consuming for them. So that is the biggest advantage of you signing up with us, because it's efficient, your time will be saved, and you'll get excellent services and a very strong application. So, good luck. And like he said, if you have any questions, then please feel free to reach out to us. Thank you and good luck.